Hi, George here, and what I'm going to do in this video is show you the supplies you're going to need when open suctioning a patient that has an artificial airway. And the supplies that you'll require will be the same types of supplies if you're suctioning out an adult, a pediatric patient, or an infant. The only difference is the size of the catheter that you'll be using will be slightly different, and the suction pressures will also be different depending on what patient population you have. So we're going to be showing you the supplies that are required for open suctioning. Now, the supplies can be used with open suctioning clean technique and open suctioning sterile technique. The only difference is with sterile technique, you're going to have a sterile field for your kidney basin and your distilled water, and you're going to be adhering to sterile technique when you're suctioning out your patient, which means you're going to be wearing sterile gloves as well as a mask and anything else for PPE. So some of the stuff that I have on the table right over here, I'll just show you. You will require gloves, clean gloves, no matter whether it's clean technique or sterile technique. Okay, so you're going to need some clean gloves, the appropriate size. You'll need a mask, right, especially for sterile technique, but you're also going to wear one to protect yourself from the patient even if you're doing clean technique, so you should have a mask. And you'll probably have an isolation gown, a disposable isolation gown, to protect yourself and protect the patient as well. Okay, so isolation gown, these are disposable. Sterile gloves. You will need sterile gloves if you're doing sterile technique open suctioning. Okay? You need some suction catheters. I've just got two here, but you might need more than that. Now, the suction catheters should be sized to the specific size of endotracheal tube that you have. So make sure you take a look at the endotracheal tube, see what size it is, and then determine what is the correct size of suction catheter that you're going to need to suction out that airway properly, but also safely for your patients. You're going to need some suction tubing like this if it's not already set up and hooked up to your suction system. Now, you may need to use two lengths of this suction tubing, so if you need two lengths of the suction tubing, remember, they don't join together. You're going to need one of these 5-in-1 connectors to do so. Now, during the suction procedure, if you want to elicit a cough from your patient, in order to do that, you might need some pinkies or some normal saline ampules like this to inject down the patient's airway to get the patient to cough or to instill the patient. Okay, so you might need these, you might be using these as well. You'll also need some blue pads. Now, the blue pads are absorbent pads. You'll place one or two on the patient's chest over top of their gown or their bedding so that if anything comes out of their airway, it doesn't wind up on their gown or their bedding. So you'll need some blue pads too. You'll need a basin, a kidney basin. Now, if it's sterile technique, it's going to need to be a sterile basin that's wrapped in its protective sterile draping. And then if it's sterile technique, you're going to have to open this up in a certain way to maintain sterility as well. You'll also need some sterile saline, normal saline. Okay? Now, it can be clean if you're using clean technique. Sterile, never open, never used before if it's sterile technique. Okay? And lastly, what you're going to require also is your suction collection unit and your suction regulator. So when you're setting your equipment up, make sure you've got the appropriate level of suction set on the suction regulator and you've tested it out to ensure that you've got the safe pressure level for the type of patient population that you're working with. So again, peds patients require their specific suction pressure, infant populations as well, your neonates as well as your adults. And once I have all this stuff set up in the next video, what we're going to do is we're going to get ready to suction out an adult patient. And that in essence again is the equipment that you'll require for suction therapy to perform airway suctioning on a patient with an artificial airway using either open clean or open sterile technique. And we call it open technique because we're disconnecting the patient from the ventilation source in order to suction out their airway. Also, one last thing to mention, in suctioning out the patient's airway with these catheters, single patient use, and it's a really good idea to change your suction catheter between the airway inside the patient's trachea, whether it's an endotracheal tube or if it's a tracheotomy tube. Use a clean one when you're going to suction out the patient's pharynx, as well as when you're suctioning out the patient's pharynx. That's typically always done with clean technique once the patient's airway has been established. This has been George, another video just showing the equipment that you require for open suctioning. I hope you like this video. Have a great night. Take care.